Hello, everyone, and welcome to another episode of What's Up Inland Empire. I'm Jessica Q, your host. Today, I have a very special guest. I'm really excited to have him here. I met him at a chamber event, and he was speaking about fentanyl. And I've got Dr. Michael Sequeira from San Bernardino County Public Health. Welcome.
Well, thank you, Jessica. Pleasure to be here, and really anxious to get the word out.
Yes, so today we're talking about fentanyl.
Yes.
You are out there, you are trying to help the community build awareness about what is going on with fentanyl with our children and their schools, with adults, with everybody. And there's a lot of different programs that you guys have going on to help, prevent more loss to fentanyl. So let's go ahead and, if you want to give everybody a quick background about who you are and, what you do, that'd be awesome.
Sure. Yeah, I'm currently the public health officer for the county of San Bernardino. So I oversee public health. And I'd come here during just the beginning of the pandemic, and they brought me into service from that way. Mm-hmm. But I was in critical care medicine, emergency medicine for like 25 years. And I was the regional director over hospitals like Arrowhead Regional and St. Bernardine's and Community Hospital San Bernardino, even down to Corona and Inland Valley and St. Mary's. So I know the county. I'm really involved with the medical society. Really know the medical society. So we're really involved, with county-wide issues. And so, I'm actually pretty local. I went to college in Pomona College, in Claremont there.
That's Inland Empire.
Yeah.
That's like, yeah.
And I had a beautiful home in Redlands, wonderful town, and really involved with the community and the Redlands Bowl and things like that. So we're, I really have a love for the people in the Inland Empire. I've worked with them a lot. I've been working with the medical society quite a lot as well. So, and part of how I got into this was I was a risk director for this national group of emergency doctors, and we started seeing a lot of people hurt from doctor mistakes or just on their own. And as it traced, we traced it to an opioid issue.
Wow.
So we were looking, why should it be an opioid issue? And what happened was what we found was that the initial phase of this opioid problem was through no fault of their own. I don't want my doctor friends to think that I'm blaming them, but the doctors were overprescribing opioids, and so you come in and you break a bone. You might break your arm bone, your radius or ulna, and they give you like
muscle relaxers, right? That's one of them.
Yeah, or like 90 Vicodin or oxycodones, and and what would happen was that there's you only need it for 3 or 4 days. We know that after a fracture. We didn't know that then, and so you'd only take it for a few days, and then there's leftover. Mm-hmm. So the kids of the parents would take this leftover, and they would actually start taking it, inadvertently. First experimentation, and then there's that whole gateway drug thing too. They start with weed or THC, and then they move up experimenting, and then they take their parents' oxycodone, and then they're hooked. And so we solved that problem with basically developing standards for doctors on prescribing. So
Okay.
So we know.
So you were a part of that?
Yeah.
Oh wow. Okay.
So CDC came out with these standards. We spread it through the community, and it actually solved. It solved the rate of overdose from prescription opioids markedly went down. But the problem now is the next problem.
What's the next problem? Yeah.
The next problem is heroin, because they take the kids would take these pills like an M30 oxycodone, and on the street it's like $60 a pill.
Oh wow.
Yeah.
Okay.
So they would get.
So that's really expensive.
Yeah, it's really
They
expensive.
can't afford it.
And
so is that how heroin
couldn't
kind of
afford
slid
it,
in?
But the friendly heroin dealers down the street said, "Here, for $5 a bag, I'll take care of your problem." Oh,
wow.
And so they got into that, and so And so heroin just took off, and people are injecting, and we've got all kinds of harm from that. And
yeah, some areas you go into, you might see like needles on the ground. I mean,
yeah,
it's really bad. Would you say heroin, with the children or with homeless, like who do you think is actually really the most involved with heroin? Is it probably more the homeless people that are
a lot of homeless? We like to call them unhoused now.
Unhoused.
But
Okay.
but people with chronic pain got into it too. But young people, I actually was a medical director at a rehab place when we detox people, and quite a lot of young people got involved with this as well, and inadvertently and then deliberately as well. So back to that, we were seeing people now using needles, right? And they don't know how to, they don't sterilely use needles, and they reuse needles, then they borrow needles from a friend. And so what they're doing is they're giving each other HIV and hepatitis C.
Wow.
And so we got a big problem with that. So, and heart infections, it's called endocarditis. And so what happened was then evolved, right, to the next phase. So the cartel and the drug dealers basically realized that, geez, we got this other stuff, fentanyl. Fentanyl is 50 to 100 times stronger than heroin. So
wow.
we can use 1/100th the amount.
100th.
Yes.
So that, okay.
Yeah, and do they have the sophisticated machinery that a pharmaceutical agency would have to be able to measure out 100 micrograms? Yeah, that's what we give people, when we're trying to fix their broken.
Because
bone.
fentanyl is prescribed.
Yeah.
By a doctor for pain.
Yeah, and it's so powerful that we only use it for if we reducing bone fractures, or if we have to shock your heart for an atrial fibrillation, that kind of thing. Mm-hmm. And we're very careful. We give it in very small amounts, what we call incrementally.
But now it's out there.
Yeah.
And people are dying from it.
People are dying.
Kids
are dying.
Yeah, and the kids are dying, right?
Yeah.
Now, can you explain how it's getting out to these children? And we're just losing kids left and right, right?
Yeah, we are. We do a death review in San Bernardino County of all the children under 18 that die. Mm-hmm. And what first alerted me was the leading cause of death in our kids aged 15 to 17 was fentanyl.
Wow.
Leading.
15 to 17.
Yeah. Over almost 33%, 1/3 of the deaths were from fentanyl. So it's a leading cause of death in that age group, 15 to 17 in San Bernardino County. And what's amazing was that we beat them to the punch, but 2 weeks later, CDC came out with, this is a national problem. 182% increase in the last year and a half. And what's the amazing thing, Jessica, is and this was just in that adolescent age group, and in 2/3 of them, there were people next to them witnessing this overdose, and they did nothing.
And they did nothing.
Nothing.
And
they
why?
didn't know what to do.
Oh.
And that's part of why I'm here. I want to tell you, there is something you can do to save someone who has overdosed. And
is there a way to help them?
Yeah.
Well, first recognizing that
mm-hmm.
they're going through an overdose. How do you notice? How can you tell?
Yeah.
Especially what if they thought they were taking something else, and it turns out to be fentanyl?
Yeah.
Well,
that's the deceptive thing too, Jessica. So what we found initially, they were smoking fentanyl, and so the people who used drugs rather than injecting, it's much better to smoke it, right? And you don't want to inject yourself; you get abscesses and HIV and Hep C. So people said, actually, street drug users prefer fentanyl. Many of them prefer fentanyl because they can smoke it rather than needle it. So it's so powerful that you can smoke it, but it's also so powerful that you can take it by pill. Mm-hmm. So if we give you morphine by pill, we have to give you a fair amount because the gastric acid, you don't absorb it that mm-hmm. much. But fentanyl's so powerful, it's enough. And so these illicit drug manufacturers started putting it in everything. And so the most recent phenomenon was they put them in what we call rainbow pills. Mm-hmm. And they look identical to an M30, OxyContin,
Okay.
but they're in pills and they look like sweet tarts. They just look like candy.
So they look like candy.
Yeah.
Oh, great. Okay.
Yeah. So,
Targeting the kids.
yeah, and our San Bernardino County Police has done at least 3 different seizures of between 15 and 20,000 of these pills, from airport seizures and local seizures, and so what's happening is we have this new group of people, these adolescents, who overdose, but they're not chronic users. So they're just experimenting, and so many of us. I remember when I was a kid, when my parents were gone, I'd sneak into their liquor cabinet and I'd just, see what the alcohol tasted like.
Yeah.
That's what they're doing. They're just trying a pill, an M30, and it's sad because then they die.
And then they're dying.
Yeah.
That's very sad. So we're going to take a quick commercial break, and we'll be right back to hear some more.
Good.
What's up, Inland Empire? It's your girl, Prizzy P, and I'm here with your weekly events for April 17th through the 23rd. You can kick off your week by attending the Healthcare Job Fair virtually from 10 a.m. to 2 p.m. It's also baseball season as the Inland Empire 66ers take on the San Jose Giants on the road April 18th through the 23rd. Do you like the Rancho Cucamonga Quakes over the 66ers? If you do, they take on the Fresno Grizzlies April 18th to the 23rd at home. Are you a kid at heart and still enjoy scavenger hunts? Well, I got some great news for you, because the Inland Center in San Bernardino is hosting one April 19th from 10 a.m. to 8 p.m. If you're into the arts, Noelle Miller will be at the Fox Performing Arts Center April 21st at 7 p.m. Or maybe you're into rock music and want to see Silverstein perform at the Riverside Municipal Auditorium April 21st at 6 p.m. You could end the eventful week filling those stomachs at the Foodies Playground IE April 22nd and 23rd. This is your girl Prizzy P with your weekly events. Let's take it back to my girl Jessica Q.
All right, thank you for that commercial break. Thank you to our sponsors. So we're back with Dr. Michael Sequeira from San Bernardino County Public Health. And now we're going to go ahead and move into what is San Bernardino County doing to help or prevent these fentanyl deaths or fentanyl getting out there. I'd love to, hear what's our solution.
Yeah, our solution is really all hands on deck at this point, Jessica. It's we partnered with the Department of Behavioral Health in San Bernardino County, and we've actually partnered with the Hospital Association, all the hospitals, the medical societies for the Inland Empire. This is Riverside County, and informed this Inland Empire Opioid Coalition.
Okay.
So we're there, multiple things that we have to do. The first thing we have to do is stop the deaths. We have to stop people from dying or being killed by this stuff. So there's this concept called harm reduction.
Harm reduction.
Yeah, that's
okay.
Probably the new wave approach for almost any drug use disorder. Is to reduce the harm, and of course, what's the worst harm?
Death. Right. Yeah.
So that's what a big part of harm reduction and reducing the deaths is being able to distribute, this drug called Narcan or naloxone to anyone out there, because people are dying everywhere and without warning. So
Narcan is the way to stop the person from dying when they're overdosing. And now you guys are making this available. So this is one of the solutions, is making it available to everybody. So you don't need a prescription to get it. So it's something you could have in your home for an emergency if it happens. Obviously, this is the thing though. I think people are gonna say, oh, my children aren't gonna do that, or we're never gonna be in that situation. But then when you are, you're like, dang, I was at an event and I could have picked up one of these Narcans and I didn't.
Yeah.
So what do you want to say? Like, tell the people out there, be like, don't think that, it's always that person that's like, oh, that'll never happen to me. And it does.
Yeah.
So it's better to be, prepared and ready instead of not knowing what to do and, losing a loved one, right?
Well, and that's the thing, is these are good that's bad, not good. It's not good or bad, but these are kids who normally don't use drugs.
Right.
And they said, no, it's not going to happen to me, but it may happen to your friend. Mm-hmm. So be prepared. And the other thing, a part of harm reduction is this thing called stigma, mm-hmm. Associated with drug use. If you stigmatize it, like I'm a bad person because I tried drugs or mm-hmm. whatever, people are not going to come to you. And we realize that they don't come to us for treatment. Because
they don't want to tell anybody, hey, I'm doing drugs, right?
Exactly, yeah.
So they become ashamed because they are ashamed.
Yeah.
As much as they enjoy doing it, they are ashamed of what they're doing, and it is very hard for them to get help, right? And it just becomes this
that shame, that
chain reaction of just
the
falling,
shame reaction.
going down.
They go into their room, a dark room, unwitnessed. They take it, and it's one of the things with harm reduction too. Never take a drug alone. You want someone right there.
Yeah. And people are probably like, oh, you're saying if you're going to take drugs, don't take them alone. It sounds funny, but this is real. This is a real thing. People are trying stuff all the time. Mm-hmm. I feel like since the pandemic, people have just become so overwhelmed with life now. Life used to be like a beautiful thing. And now every day is like, what am I doing? Where am I going? And especially with social media and all,
Oh, it's so true. And, Jessica, the thing is that fentanyl's in almost every one of those drugs. They have these Xanax bars. Xanax is pretty popular because it reduces anxiety.
So Xanax is something you can go to the doctor, and if you are experiencing anxiety, they just prescribe it to you. But now you said, wait, you called it a what?
A Xanny bar. They're
a
like
Xanny bar?
They sell
okay,
them.
It sounds yummy.
They're brownies.
Really? So like a weed brownie, but a Xanny brownie?
Right.
Oh my goodness.
Xanny bars, and you just buy them in boxes, and you just sit there. Have them with milk, of course.
With milk? Yeah, you gotta have the milk with your Xanny bar.
But they're lacing Xanny bars with...
now they're lacing the bars.
It's fentanyl
with
now.
Yeah. So some of these kids think they're having a brownie, and they might not even know. Their friend might be like, here, I made brownies.
Oh, yeah. It could be at a party where somebody brings them in. Hey, have a brownie.
Just have a brownie. They don't even tell them.
Who doesn't like a brownie, right?
And so who's making these brownies and who's lacing them with the fentanyl?
That's the thing.
Is that the drug dealers that are actually making it, or is it?
Yeah.
It's
probably the bulk chemical products are coming from China, and then they're going to Mexico, and then they're manufactured in Mexico, and basically they've got a distribution process that's almost impossible to track. They have small couriers everywhere. Kids can drop a pin if they have the right number. They call a phone number, they drop a pin, and a courier will come in and deliver it. So
where do they get this number?
It's published through various social media.
Really? Which social media do you think is the worst that's helping children access drugs? So parents, take note of this. This is the one social media platform that your kids are able to get drugs easily. What is it?
Probably the one I hear most is TikTok.
TikTok.
Yeah.
Oh, did you hear what's going on with TikTok?
Tell me.
They've been there's a case going with the founder of TikTok. The U.S. wants to ban TikTok. There's a lot of stuff about TikTok. That could be a whole nother episode.
Yeah, okay.
But yeah, so it's doing more harm than we even imagined, huh?
Yeah.
So now it's the doorway for the kids to get their drugs. Wow.
Yeah, absolutely. Okay. And that's one of the messages we want to get across is to everyone, not just the adolescent kid and the kids, but to everyone, is that if you buy something on the street, and the DEA has estimated this with bulk testing, there's a big chance, like probably a 2/3 chance that it's going to have fentanyl in any illicit drug. So that's the necessity of having the Food and Drug Administration and certifying that this is whatever drug it is, because when you buy it and it's not FDA approved, then you're more likely than not dealing with fentanyl. And the problem is, there's just like 12 granules of fentanyl. If you take salt and look at those granules, take 12 of them. Mm-hmm. If that can kill someone who doesn't have.
If it's fentanyl, that's how much? Just 12 little grains of the
the
salt.
chemical. Yeah.
Yeah. Wow.
Just, I mean, it's so powerful. And there's a couple other things. One is they're experimenting with super fentanyls.
Super fentanyls?
Yeah.
What is that?
One's called carfentanil, and it's an elephant tranquilizer.
Oh my goodness.
It's 6 times more powerful than fentanyl.
Than regular.
And what we're finding recently is this other drug called xylazine. It's called Tranq, Tranq.
Okay.
And that's an animal, dog, and horse tranquilizer as well. They're throwing it in with fentanyl, and the purpose of that is because fentanyl has a very short half-life, right?
Mm-hmm.
It's gone in like 30 minutes or so.
Okay.
So they're throwing Tranq in to prolong
the effects,
the
feelings that you get from it.
The feeling, and also to what we call mitigate or lessen any withdrawal they have. Because 80% of why a chronic drug user takes the medicine, whether it be heroin or fentanyl, is to avoid the withdrawal. You know, so if they can prolong those symptoms of no withdrawal, then they'll take it. And so this xylazine is and it's interesting. Finding out, we didn't have a blood test for it, so we didn't know in the ERs or whatever that
if somebody had it in their system.
And
okay.
Sometimes we had overdose deaths, and we measure for opioids. And before this new law, we didn't have a test for fentanyl unless we specifically ordered it. So we figured most of these are fentanyl. Now we tested for fentanyl. We're testing more for fentanyl, and we're realizing these people are dying in fentanyl negative, and they're probably the Tranq. It's probably Tranq that's doing it. Mm-hmm. But that brought me to another harm reduction thing. Okay. Besides Narcan, we went. By the way, we're trying. All of our workers going into the field are carrying Narcan now.
Okay. Is that including? So your workers. So that means you have one in your car. Do you keep one on you?
Yeah, I have 2, and I actually have a box of them at home.
Okay, and then I'm assuming ambulances, police are now carrying them as well. Okay.
Yeah.
Now, because you did say they were. Now you can actually get them without a prescription. Just real quick, how can people get a Narcan if they want one right now? They're like, you know what? I want to be safe for me, my family, my friends, anybody, my neighbors. Where can they get one right now?
Yeah, it's really, really tough right now because it's not by prescription.
Okay.
But at the same time,
can they
it's
go to the
expensive.
county? Oh, it's expensive. So
if you go to a pharmacy, whatever pharmacy it is, I'm not going to name any, but it'd be $80 or so.
Oh wow.
$80. So,
but they are available at pharmacies.
Yeah.
So if you go to a chain pharmacy, they most likely have them.
Yeah.
But they're $80.
Sure. Yeah.
Okay. So and then now we get into that's a lot of money. Like if it was free, then I would just have one at home. Like remember they were giving out the COVID test, so so you had those. People would have them, and it was just there. But if they had to buy them, they wouldn't want to, right?
Yeah.
So okay, wow.
So we're trying to solve this, and the government's helping us.
Okay.
So there's this project called the Naloxone Distribution Project, the NDP.
Okay.
So organizations like schools, or even your local PTA, you can apply for this and get free Narcan.
Okay.
Yeah, and so.
But you have to be a nonprofit, or
no, any organization like the schools, like it can be a for-profit school, whatever, like Montessori or.
Okay. But you can apply
schools.
for it. And is there a website that they can go to apply for it?
Yeah, absolutely.
What's the website?
So they can get free Narcan, and that's the whole key is to get it out there. So we have the NDP, and we're trying to get it into schools too.
Okay.
And there's a new law, the Hurtado law, that actually requires all University of California's, all Cal States, and all community colleges to offer Narcan now. So. Yeah, we're getting the word out.
So you are, and just being on a podcast, also speaking to the community is a great way to, spread the information, build awareness, because we want this to stop. This is our next pandemic right now that we're dealing with.
It is.
Real quick, we're gonna go into another commercial break, and we'll be right back. Are you ready to have a white and bright smile? Then it's time to order Qattawai Wowi. Go to QattawaiWowi.com to learn more about this system that works in 7 days to give you a bright smile. Use code podcast and get $20 off. All right, we are back from commercial break. Thank you to our sponsor, Qattawai Wowi. And we've got Dr. Michael here. Okay, so let's get back into this. So, what else do you want to tell everybody? We got 10 minutes, and I really just want you to be able to tell everybody exactly what you want to see out of this podcast. Like, if you can make a difference in everybody's lives just from this podcast, what is it? What do you want to see from us?
Well, I want every listener and everyone in the studio as well to be aware of the dangers right now. It's an extremely dangerous situation and environment when you branch out into illicit drugs. So, one of the first principles, and I had mentioned it before, Jessica, is that just assume fentanyl is in everything that you take if it's an illicitly made drug. So, number two is recognize what an overdose looks like. The Surgeon General was he basically, I was at a conference with him, and he held up a Narcan box and he said, "You guys all took CPR, right?" And yeah, we all waved. Right? And of course, I'm an ER doc. And he goes, "Chances are you'll use this Narcan before you need CPR."
Wow.
Before you use CPR, because the chances are, in terms of a death you see on the street, someone who can't wake up, probably is an overdose. So presume if it's an illicit drug, it has fentanyl. Presume someone laying there unconscious probably has an overdose.
An overdose.
Yeah, and there's ways to recognize it. They don't breathe that well. They have pinpoint pupils, and you can't wake them up. You rub their breastbone, their sternum, and you can't wake them up.
But they're slightly breathing, so obviously
Right.
that's not where you need to come in with the CPR.
Right.
So that's kind of how you know. Now, let's say, somebody did find somebody unconscious. They had the Narcan and they used it on them, but they weren't overdosing from fentanyl. Is that going to hurt that person?
So, such a great question, and I'm glad we didn't cover that. So, thanks for bringing that up.
Yeah.
Narcan is completely harmless. If I took some now, and if you took some now, you'd hardly even feel it.
Okay.
I mean, and you can't overdose on it. It's extremely safe.
Okay.
It's not addictive. So the only thing that might happen, and we saw this in the ER, when we get overdoses in the ER, we just slam them with IV Narcan, and they withdraw. I mean, so they're...
Oh, they withdraw. Okay.
Yeah, and sometimes that's pretty violent.
Oh, is it?
Someone who's just...
I've never seen anybody go through withdrawals. How does that... What does that look like?
Well, it's a whole spectrum. It starts with just shakes and, basically people getting confused and with opioid overdose, they get like goose flesh and they're vomiting, they're incontinent, they lose their urine, their stool. It's ugly. It's sad. So and then eventually. That's withdrawal. Okay, and so it's not a good feeling. So that's again, I'd mentioned that. That's one of the reasons people, probably 70-80% of the time, people on chronic opioids will take it just to avoid withdrawal.
Oh wow.
Yeah.
Okay.
So.
Okay, and then so I think that was we're talking about number 2. I think you're on number 3 now.
Right.
What was the next?
Yep. So all these things are kind of presuming the worst, and that's where my ER background is. You always presume the worst, right? And if the best comes, you're fine, right? You're happy, or it's copacetic. But so you presume the worst, that the drug has fentanyl. You presume the worst if someone's laying there unconscious or sleeping on the curb, that it's an overdose. Okay.
Okay.
The third is presume it's going to be out there, and high schools or whatever, a big party at raves, the GSB and the stuff at the raves is still going to be there, but you know what? It's going to be laced with fentanyl, and so what we're really worried that it's going to start. At these raves, we're going to start seeing ODs. Actually, we have.
I was gonna say, have you not already? I know we have like the Orange show, right? And they're always having raves there. They probably have about like 4 or 5 raves a year. So that you've seen stuff come out of there?
Yeah, it just puts us on edge. If you get 50,000 kids there, and
Do you guys have a team that's at those events?
We require the rave producers to have teams out there.
Okay.
The
That are ready
paramedics.
with Narcan and
Yeah.
everything.
Yeah.
Okay, wow.
And we want to pass it out if we can. So
Okay.
so-
That's a great place. They want free stuff anyways. You're like, here's a Narcan. Save a friend. Save
Yeah.
yourself.
Yeah, so presume it's going to be out there, okay? And so it's and the fourth. Are we on 4?
Yes, they're on 4.
Is know that there's an antidote out there. So you just look around, ask. We're trying to get it. And if people, parents, kids, anyone wants to get a hold of some Narcan, just call public health.
Public health.
Or Department of Behavioral Health.
Okay.
And we can lead you to the right avenue.
Perfect.
Insurance companies will cover it too, and so even though it's non-prescription now, most likely.
But if you go through
they
if you have insurance, you can reach out to
will.
them.
Yeah.
Okay. So there's ways to get it.
Yeah.
And I think.
And the 5.
Oh,
I'll
there's
give you a
5. Oh, yes, I love it.
Harm reduction. Okay.
Yes, that's what I was going to bring up, because I really like that harm reduction. Yes, it might sound like you're saying, "Oh, it's okay," but obviously, it's not okay. But we want at least people to feel comfortable to come to anybody and say, "Hey, I need help," or right?
Yeah.
Yeah.
It used to be in the old model, like with alcohol, and AA is an excellent organization, not putting it down at all, but it was all or none. And if you're helping someone who's drinking, you're called an enabler, right? So you're enabling their drinking problem. Well, what we found with the drugs, and even actually with alcohol, is with the harm reduction principles, if you stigmatize it, they're just going to do it in the closet. They're going to do it in the back alley. They're going to take it anyway, and it doesn't work. There are a small population and a significant population of AA people that have kicked the habit, and and it's wonderful. So I'm not putting that AA down at all. But with harm reduction, what we've noticed with kids, they're just going to go into the cracks in the woodwork. So what we've got to do is to stop destigmatize. We've got to destigmatize it. Addictive drug use is not a character flaw. That's an important part of all this. It's a disease, and it's called what we call the disease model of addiction, and we can actually trace it to very specific parts in the brain, and we can trace it to very specific neurotransmitters, neurochemicals. So it's not only anatomic, it's chemical, and it's in your brain, and these dopamine rushes that people get. It's one of the reasons some of these guys who like to climb El Capitan without ropes, they get dopamine rushes, right?
Yeah.
So that's what drugs do, is they cause these dopamine infusions in the brain, and it just makes you feel good. And so
now
so
you
it's
say,
a
because
disease.
it's a disease. So
Yeah.
is this something that's we're born with? Like it's already it's planned out for us? Like, hey, when you hit 35, you're going to feel like this? Or would you say it's because of maybe past traumas that cause us to get this disease? Or how would you describe that?
The answer is yes.
All of the above?
to all of the above.
Okay.
So
okay.
we can trace it. And we can trace it to it's congenital for sure. And we can trace it with PET scans, these advanced scans, to actually there are areas in the brain. So it is congenital, but also, there's the social cultural issues, the family issues. We know that children of alcoholic parents are going to have a high degree of anxiety, PTSD, and alcohol or drug use issues. We also know that people who have psychiatric problems basically have a much higher incidence as well. And we've definitely found, and this is a public health issue, in our segments of our county or wherever you are, the people with the least money, who have no transportation, what we call the social determinants of health, those people are hit particularly hard with drug use, with actually COVID, you name the disease, because that's a chronic problem. And that's why public health exists. We're out here. We're out there to help these people. And as it's that whole concept of equity, I'd love to come on and we could talk about equity too.
Yeah. Okay. Well, we'll have to book you for another episode then.
Sure.
I'm sure there's a lot to talk about, but yeah. Any last words before we sign off?
No, I just if you need help, if you need information, if you need Narcan, give public health a call. We'll steer you in the right direction. We can't do it ourselves.
Awesome. Thank you. Yeah. And also, instead of, going to drugs, maybe go watch our last episode or listen to our last episode with our mindset coach. She provided a lot of very healthy, natural ways to feel better. But thank you so much, Doctor. It was such a pleasure to have you and so much amazing information. It's great to know that our county, San Bernardino County in Inland Empire is, out there working hard to try to prevent, this pandemic, the fentanyl pandemic, from really, growing and taking more lives. So thank you. I hope you enjoyed being on the show.
My pleasure. Great to be here, and I appreciate the opportunity for sure.
Oh, yeah. Thank you. And thank you guys for tuning in, listening, and be sure to subscribe to our podcast, our YouTube channel. And we will see you and talk to you next week. Bye.
Hi, this is Pablo with 1-800-BIZ-BROKER. And yesterday we had a question from Jose. Jose owns a Mexican restaurant in Riverside County, and he had a question about how he can make sure that he can increase the value of the business besides increasing sales. Well, Jose, the most important thing about restaurants is consistency. So if you have a plan in place where you can, for example, have a database of your clients where you can text them regularly or email them regularly, that way you keep them coming back, then you can lower your marketing costs and make sure your guests keep coming back. So, Jose, if you have any more questions about your business or increasing the value of your business, or anybody else out there has a question about business valuations, go ahead and give me a call. I'm Pablo with 1-800-BIZ-BROKER.